Let's look at having more information about heart attack through some of the common questions which are usually in the minds of the people. I'm Dr. Sashi Srivastav, Senior Consultant Interventional Cardiologist at Yashoda Hospital, Hyderabad. We will learn a bit more about heart attacks, in whom they occur, what is the immediate treatment, how do we recognize them, and what are the definitive treatment. So one of the questions is, at what age do heart attacks typically occur? So previously, heart attacks used to be more common in elderly, 60 plus or 70 plus, usually in those with long-standing diabetes, long-standing hypertension. Nowadays, because of the change in lifestyle, we are seeing a lot of heart attacks in younger patients, particularly in those who continue to smoke, who have cholesterol abnormalities, who lead a lot of stressful life, and who do very little exercise. So the age group has shifted from elderly patients to middle-aged or even younger patients, including those below 40 years of age. So heart attacks can be seen in any age group, but the risk factors are smoking, stress, physical inactivity, and genetic predisposition in younger people, and long-standing diseases like hypertension, diabetes in elderly patients. Let's look at another question. Do heart attack symptoms differ between males and females? Yes, symptoms are relatively difficult to identify in females. They may have non-specific symptoms, vague chest discomfort, or pain abdomen, or generalized weakness. Males, again, in diabetics, the symptoms may be masked because diabetic blunts the nerves, have blunted nervous system, and then they may not feel the pain as typically as those without diabetes. The classical symptoms of heart attack are pain behind the chest bone, sweating, left arm pain, giddiness, falling down, and extreme weakness. Sometimes the patient may collapse, and this may be the first sign of heart stroke. How does a heart attack first start? Now, heart attack may start with sense of doom, sense of illness, generalized weakness, pain behind the breastbone, and which may increase over a period of time associated with sweating, jaw pain, left arm pain, or even pain abdomen. Any that makes you feel awkward or weak, you should seek medical attention, because it is very difficult sometimes to differentiate between actual heart attack, gastric trouble, or other conditions. So to be on the safe side, it's always better to seek medical attention to decide whether it is cardiac problem or not. What is the first stage of heart block? Now, many people have the opinion that heart blockages are diseases of the elderly, but recent studies have shown that cholesterol deposition, blockage formation can start in the younger age group also, as early as second or third decade. As the narrowing slowly progresses, the cholesterol, the blood clots, and fibrous tissue and calcium deposit in the vessel wall of the heart, and slowly as the narrowing increases, patients will have symptoms. It might happen suddenly, when we will call it as heart attack, or it might progress over a long period of time when they have symptoms only while exertion. So let's look at another question. How can I check for heart blockages? Yes, it's an important question that you need to check for heart blockages. So preventive health checkups play an important role in detecting heart blockages. The basic health checkup should begin at probably 35 or 40 years. It should include ECG, a 2D echo, which will detect when the heart is pumping normally or not. And apart from that, the cardiologist may advise, depending on the family history or risk factors, further specialized tests like treadmill test or CT coronary angio. These will help you detect blockages at an earlier stage. Based on the findings, we can start preventive steps like controlling the diet, increasing the exercise frequency, taking medicines to control hypertension and blood pressure, and also medicines for cholesterol like statins. The next question is, how can I be sure I am not having a heart attack? Now, this is a difficult question to answer. Not sure having a heart attack is difficult. So any person who experiences pain from the jaw to the abdomen and which is causing discomfort should seek medical attention. The doctor may do an ECG, which again may or may not show evidence of heart attack. If the initial ECG is normal, it is worthwhile to repeat serial ECGs and see for any changes. Second, there are blood tests which will detect heart attack early, like troponins and CKMB. These will be advised depending on the duration of the symptoms and the character of the pain and also ECG findings. 2D echo also will help you identify if there are any changes suggestive of heart stroke. Apart from this, the definitive investigation to rule out a heart attack is doing a coronary angiography or angiogram in common words, wherein from the leg or hand blood vessels, a small catheter is passed and a dye is injected to see if the vessels of the heart are flowing normally or if there are any blockages ranging from mild to sometimes total blockage. The total blockage may cause heart stroke. So ECG, 2D echo, blood test like troponin, and finally angiogram. These are the ways in which we definitely diagnose heart stroke. What are the treatment options for heart attack? Now, whenever the patient is confirmed or diagnosed to have a heart stroke, he is usually under the care of a cardiologist or in remote places under the care of a physician. The patient is given medicines like aspirin, which can be life-saving and which has saved most lives than any other drug, and other blood thinners. Apart from that, if the patient is in a distant place away from the cardiac center, we can give clot-busting injections, which are called thrombolytics. These are injections which can be given under the supervision of a physician or cardiologist, and they will likely dissolve the clot to a large extent. The efficacy of these injections is best if they are given within 3 to 6 hours. So these are the first line of management. Suppose the patient is in a setup where the patient can be taken for angiography and stenting immediately. That's the best treatment. We call this primary PTCA. So whenever the patient comes to a cath lab available hospital and availability of a cardiologist 24/7, he is wheeled into the cath lab. An angiogram is done to identify the blockages, and if it is significant blockage, that is more than 70%, blockage is cleared and a stent is put depending on the necessary established flow. Now, primary PTCA or angioplasty done in the setting of heart attack has been scientifically shown to be superior and has saved a lot of lives in the last couple of decades. So that is the first choice of treatment. What precautions should be taken after heart attack and what is the best food for cleaning arteries? Now, once the patient is found to have heart attack and he undergoes definitive treatment like angioplasty, then the patient should be careful to prevent recurrence of the heart attack. He or she will be prescribed medicines to maintain the patency of the stent, or the stent should have blood flow going through it continuously. Apart from that, medicines are prescribed to prevent high cholesterol, to control blood pressure, to control dialysis. And the patient is prescribed exercise regimen, that is at least 30 to 40 minutes of brisk walking or any other aerobic activity for at least 5 days a week, or at least 150 minutes per week. Apart from this, diet plays a very important role in preventing further heart attack. The patient is advised to take healthy diet, more green vegetables, more natural substances, healthy fruits, and is advised to cut down on processed foods. Also, lean meats are preferred like fish and chicken, and red meat is avoided. High carbohydrate diet, fried foods, fatty foods are typically avoided to prevent recurrence of heart stroke. Should we take medicines lifelong for preventing heart attack or after a stenting? Yes, aspirin is usually continued lifelong. There are other blood thinners which can be used for about 1 year, and depending on the need, the cardiologist adjusts the medicines. Usually, the patient is also prescribed medicines to control cholesterol, which have to be taken for a long term. In addition, blood pressure, blood sugar, and cholesterol should be maintained within normal limits. Weight also should be tried to be maintained in normal limits. These are the precautions you take after a heart attack.